Good afternoon, everyone. I'm Jennie Montgomery. Thank you so much for joining me for this live Jennie show as we strive to bring you the latest information you need to know as we work together to stop the spread in this coronavirus outbreak. Well, as the governor is really making a tough stand when it comes to enforcing CDC recommendations, now closing the state's beaches. Governor Henry McMaster has also closed all the boat ramps and the landings on lakes, rivers, and waterways. The governor says this is a direct response to people not following social distancing guidelines. And that, of course, is something that we have seen here in our area. And health measures like those that the governor is taking are important to people who are in the medical field. Naturally, we have checked in with Laurie at University Hospital for the latest there. Laurie, I know this is a very, very busy time for you, and thank you for making a few minutes to talk to us this afternoon.
Jennie, I'm so thankful to be with you, at least via Skype. When this is all over, I can't wait to see you face to face again.
Absolutely. We appreciate our Giving Your Best partners so much, and we're usually talking about really happy things in the community and this sort of thing. This is when we need to be able to rally around you all because you are on the front lines here. And this is a very challenging time for the whole community, and it is an especially challenging time for our healthcare workers. Just give me a sense of what it is like right now where you are.
So University Hospital has a 202-year tradition of taking care of the community. That's no different today. It does mean that we need as much help from the community as we can to do our jobs. We have to salute all those frontline caregivers and the support staff who are making their jobs possible and safe. So from our housekeepers to the folks making food at the hospital, to respiratory therapists, to physicians, to nurse leaders, to folks in finance, human resources, the foundation. There's just a whole group of folks who are working in concert for the benefit of this community we serve. And we are so grateful for every gesture that the community makes in appreciation of what folks at our hospitals are doing. And Jennie, we've been so fortunate. Folks have called and said, I have N95 masks, I have isolation gowns, I have face shields, I have food individually wrapped that I would like to supply some of your staff with. Mm-hmm. The folks who say, help me pay for childcare so that nurse working in our ICU can come to work. Her kids are out of school, schools are closed. The foundation is helping defray the cost of childcare for that nurse so she can be at work today and not at home with her kids. So it is really a challenge, but we're so thankful so many have stepped up and asked us specifically what we need most. What we need most are contributions to University Healthcare Foundation in the form of monetary donations. And if folks want to do that, it's easy to do on our website, universityhealth.org/charitable-giving / and I know you're going to make that easily available to folks. But for those who also have supplies, currently University Hospital is stocked with the supplies we need to take care of folks, but we have physician practices, independent physicians who've reached out to us and have asked us to help supply them with things like masks and face shields and things like that. So we are collecting those things from the public. We've had some wonderful contributions. A gentleman named Mark Taylor from, I think it was Finish Line, I believe it's a car refinishing shop. He was one of the first folks to run down with N95 masks. We're very thankful for everyone along the lines. EasyGo, the contribution of 1,000 masks. So we're thankful for your support. We do have the supplies we need to take care of the community, but physician practices are reaching out to us, so we'd like to be able to supply those folks as well, because that's safety. If we can keep this infection spreading, if folks can stay home, wash their hands, and if we can make sure everybody has the supplies they need to take care of this community, we'll get through it.
And people have to understand that in a time like this, you have had to make changes at the hospital. There's a different protocol, and it's for the safety of the patients and for the healthcare workers, because we have to keep the healthcare workers well also.
Absolutely, and I'm so glad that you brought that up. It is a change. We are used to having visitors at our hospital. to support patients, and we understand how much people want to be with their loved ones, but we have a no visitor policy in effect for our hospital currently. That could change as things get better, but for right now, for today, as we talk today, we have no visitors, and that means that if you are coming with an outpatient and you would like to come in with them, we're not permitting anyone to come in unless that person is absolutely necessary for communication purposes.
Yeah.
We have transporters. We can get your loved one around. I want to go see my mom. She's in the hospital. Can I please go visit her? We're asking that you not visit. We're not permitting you to visit unless there are special exceptions, and those, Jenny, are just the saddest of all end-of-life situations. And you have to be pre-cleared by a physician, and we're limiting those visits really for the safety of all concerned. It's for the safety of our visitors. It's for the safety of our patients. It's for the safety of our care teams. We are doing all we can to keep our folks safe.
Well, we know that you are, and we also know that you all are doing what you're doing with compassionate care. Laurie, thank you so much for your time today. We do have the information on our screen, and people will be able to get a hold and help meet those needs for the different practices in our community. Thank you again, and stay well.
Jenny, I appreciate you. Thank you. You too.
All right. Bye-bye.